Hello, my name is Matt King. I'm going to be doing a newborn assessment today, so let's go for it. Hi, my name is Matt. I'm a student nurse here in the hospital. I'm going to be doing a newborn assessment for you. The procedure should take about 10 to 15 minutes and will involve some light touching. Yeah, is that okay if we do that? Okay, great. I'm going to go ahead and perform hand hygiene. Cool. I'm going to just check the baby's identifiers, confirm two ID points, their name and date of birth. The first thing I do is check the APGAR score by checking the activity of the baby, noting that it's very active, moving about. I'm going to check pulses. I'll check the brachial and radial pulses to make sure that the pulse is above 110 to 160. The grimace, the baby is crying loudly and with strong and lusty cries, so it will get a score of 2 there. Appearance, the baby is pink all around. There's no cyanosis, so also a 2. And respirations, the baby is breathing easily and unlabored. The nostrils are not flaring, so the baby is also breathing 30 to 60 breaths per minute, and we'll also get a 2 there for a total of 10 for the APGAR score, which is normal. So first with the baby, the posture is flexed and the limbs are moving freely, so that's within normal limits. Vital signs, the temperature we would check in the axillary. The temperature of this baby is 37 degrees Celsius, which is within normal limits. The pulse for the baby, we would check, and it would be between 110 to 160. Respirations for the baby are between 30 and 60. And blood pressure is between 65 and 95 for the systolic, and 30 and 60 for diastolic. Next, we're going to check the head. We're going to palpate the suture lines of the baby. We're checking the coronal, sagittal, and lambdoid sutures. We're checking for any abnormalities. We're checking the anterior fontanelle, which should be diamond shaped and 4 to 6 centimeters. It's also soft and flat. We're also checking the posterior fontanelle. It's triangular and it's 0.5 to 1 centimeters, and both are within normal limits. We'd measure the head circumference. It should be between 32 and 38 centimeters for the baby, and this is within normal limits. We check the appearance of the skin for any birthmarks, Mongolian spots, nevus simplex, or nevus flammis. With all birthmarks of the baby, we'll check the back here too by supporting the neck and rotating it over. With all birthmarks of the baby, we would document the color, size, shape, and tendencies for blanching. We'll also report any forceps or vacuum marks that were present on the baby's head from the delivery. And this baby is normal and within normal limits. For the eyes, we're going to check that the eyes are symmetric, are clear. The sclera is china white and is reacting and following and tracking. The eyes appear to be within normal limits. There's no cataracts present. The nose, we'll check the patency of the nostrils to make sure both nostrils are open. We'll occlude each nostril at a time to make sure that the baby's breathing properly and that there's no flaring or respiratory distress. For lanugo, small amounts of lanugo are present on the shoulders, face, forehead, and upper back, but that is within normal limits. For eyes, the eyes are symmetric. I already said that. Nose, ears. So next is ears. The ears are well formed, the cartilage is present, they bounce back, and the eyes are even with the ears are even with the eyes. There's no skin tags, and yeah, both ears are open and appear to be within normal limits. Mouth and chin, the mouth, let's see, so I'm gonna put a glove on. The mouth appears to be symmetric as well. The tongue and gums are pink. There's normal movements. When performing the reflex check, the baby responds to it, and there's if I insert my pinky, there's a sucking reflex that is present. When palpating the lip, there's no cleft lip or cleft palate, and also the gag reflex is present. The baby has a strong and lusty cry, which was noted with the APGAR score. The neck is short and the head turns easily side to side, which is good. There's no webbing. The infant raises the head when prone. Palpate, the clavicles are intact. Let's see, there's no, when palpating the neck, there's no gland enlargement. That seems to be within normal limit. Chest is symmetric. We'll measure the chest as well. The chest is symmetric. The nipples are present and well formed. The chest circumference for the baby is 32 centimeters. The breast tissue for this baby, the nipples are well raised. It can be discerned from the surrounding tissue and is 1 centimeter at term. The lungs will auscultate. Let's see. So normally we'd listen for a full minute. Lung sounds are clear in all fields, and then we'll rotate the baby again, supporting the neck. Lung sounds are clear in all fields. There's no respiratory distress. And respirations are between 30 and 60 respirations per minute. Heart sounds, we'd auscultate for heart sounds. We're looking for a heart rate between 110 and 160. So auscultating the heart, we're listening for the aortic, pulmonic, Erb's point, tricuspid, and mitral. There's a regular rate and rhythm. S1 and S2 are present. No gurgling or swishing sounds are detected. Looking at the abdomen, the abdomen is soft and round. When we auscultate again, we're listening for positive bowel sounds, which should be present 15 minutes after the delivery of the baby. So they're positive bowel sounds. The umbilical cord is present on this baby. There are 3 vessels present, 2 arteries and 1 vein. For the stool, we monitor for the stool, which should be within the first 12 to 48 hours postpartum. And the stool should not be watery. We document for color, consistency, and amount. This is a male baby, so we would check the formation of the genitals. We make sure that the genitals are well formed, that there's rugae on the scrotum, and that there is a meatus at the tip of the penis, and this baby is within normal limits. We check and document for the urination. The first void should be 12 to 24 hours postpartum. We're looking for the color and consistency of the urination. With upper extremities, we're checking that they are bilateral and equal. We're checking to make sure that the size of each limb is correct and equal. We're checking for the correct number of fingers. We're examining to make sure that the hands are well formed and the digits are of equal length. We're checking the correct number, location, and formation of phalanges. There's good flexion and muscle tone, and the length of the nails are normal. With the lower extremities, we're checking there's equal length, that they abduct equally, normal position of the feet, the correct number, formation and location of the toes. There's no club foot. The nails are normal. We'll check Barrow's reflex by checking the adduction one at a time. And then we'll also check the ortolani, the abduction of each hip one at a time, and that is within normal limits. The back and spine will gently rotate the baby while supporting the neck. We're palpating to make sure that the spine is equal and symmetrical. There's no tufts of hair unusually. There's no spinal bifida present, and the spine appears to be within normal limits. With the buttocks, we're checking to make sure that the anus is patent and present, and the sphincter is closed tightly with no dimpling. Back on the side, we're checking the radial, brachial, femoral, popliteal, and dorsalis pedis pulses. They're all 2+ and equal. Again, we would check the apical pulse for 1 full minute, and we're looking for a pulse rate of between 110 and 160. When we weigh the baby, it should be between 2,500 and 4,000 grams. And we'd also measure the length of the baby, which should be between 45 and 53 centimeters. For the reflexes, we check a rooting reflex to make sure that the baby's head turns to the side when touched. The Moro reflex, we would check by initiating a startle type reflex to see if the legs and arms extend when startled. The tonic neck, we would turn the baby's head to one side and make sure that the same side limbs also abduct as well. We check the Babinski reflex when the toes flare when the big toe is dorsiflexed. The palmar grasp, we check to make sure that the hands grasp when touched, and also the plantar reflex, that the toes curl forward when touched on the bottom of the foot. And then last, we would check the stepping reflex to see if the baby has the reflex to try and perform some basic steps. And that concludes the infant check. Yeah.